So the scope of sexuality issues, there's 40 to 100% of cancer patients experience some form of sexual dysfunction. And these issues often don't resolve after therapy. And almost all cancer treatments, as we've heard before, have the potential to alter sexual function. Surgery, chemotherapy, radiotherapy and hormones. And it does represent a major quality of life, one that we don't always see within the hospital, but it's what's happening at home in the communities for those patients or consumers. But with intervention, up to 70% of patients can have improved functioning. So they did do, as part of this tool, they did a lot of work, and part of it was doing a survey of physicians and patient communications. And this was some of the outcomes. They asked, would your doctor be uncomfortable talking about the problem because it was sexual in nature? And as it shows there, some of the patients were very concerned that that would be so with their doctors, and some were somewhat concerned. Some of them felt that their doctors would dismiss their concerns and say it was just in their head. That was 51%, with 20% somewhat concerned. And some people felt that there'd be no medical treatment for their problems, so often they wouldn't ask questions. They also looked at clinicians' beliefs. A lot of clinicians, or some clinicians, might feel that someone else will do it. Patients never ask about it, so they mustn't care. I don't know how to help, and sometimes they don't have time to help the patient. They might not agree with the person's lifestyle if there's different gender issues. Some patients have said that the doctors felt that they should be happy to be alive, to have had their treatment and happy to have survived. Some people say that they feel that they're too old to worry, but it is still a worry to them, or they've been too sick. And some of the consumers feel that they'll offend their clinician by asking those questions. They feel that they're being selfish, that they should be pleased that they're alive, and that they're being selfish by wanting more, which is just what a normal, natural person would like in their relationship. So the Gynaecology, Oncology, Psychosexual Learning Tool is at Cancer Australia. So you can just Google it, and like I said, the fact sheet is there in your little booklet. The treatment for a gynaecological cancer can alter a woman's behaviours, attitudes and feelings towards sexuality, and health professionals require knowledge and skills to minimise the risk of these concerns. So the aim of the program is to look at this and to try and help us to improve in this area. So if you go online, this is what it looks like, and it has 6 modules, and they start off with very basic introduction, and they can work their way up. And if you're working in gynaecology, probably if, say, you're on 4SMG, it'd be good if you had at least 1 through to 4 with the modules. And if you were working specifically with gynaecology every day, if you go up as high as number 6, because it does go into specialist care, and you can get a certificate at the end of it, and it will give you points. So it was started up, this tool, with the project team, Patsy Yates, who most people in oncology know very well. And they had a registered nurse, they had a psychologist, a social worker and an educator. And Dr. Margaret Davey also helped from Gynaecology. They looked at literature, and they looked at the framework, how they wanted to set it up. They did some piloting within New South Wales, is where they first started it. And then they implemented it, receiving feedback on how well it went. I attended one of those workshops and gave very positive evaluation because I thought they were excellent. So first of all, they did studies, and they looked at studies which explored or explained the psychosexual issues experienced by women affected by gynaecological cancer. And the search strategy they looked at from about 1999 to about 2010. And they went on good evidence-based practice databases. The literature search, they looked at 116 papers, and they looked at psychosexual sequelae, supportive care, quality of life, health professional practices including interventions, and the topics were analysed to identify competencies relevant to health professionals in various practice settings, and to guide the development of the framework and educational resource. Developing the framework, as I said before, basically modules 1 and 2 are for universal. So everybody who works within a hospital or GP or out in the community, it's really handy if you could have at least done the first 2 modules. And it doesn't only apply to cancer, it applies to patients all over. That's a good part about it. And there's a lot too about the age, because we do have an ageing population, so there's a lot there about gerontics as well. Levels 3 and 4 is the extended. So like I was saying, if you're working in the area, it's handy if you can do this area, if you can go on and do those 4 modules. And going on to the specialist care, where you're looking at counselling people with their sexual difficulties. So that's what it looks like in the triangle pyramid. So universal helps you with that just basic health professional care, but you can go on there as a patient or a consumer as well. It is applicable. The extended knowledge and skills will give you a bit more help with looking after patients with these problems, and the specialist area at the top. So developing the modules, if you look at it, number 1 looks at basically understanding sexuality. So if you want to know a bit more about sexuality, go on and just, even if you do number 1, like I said, you can do it all in your own time. You can go back and revisit. Number 2 was understanding the experience of the patient with psychosexual problems. Number 3 was inquiring and how you can respond as a health professional to those needs. Number 4 was understanding what happens to make the patient feel this way or the consumer feel this way. Number 5 is how you can do a good health assessment. And there's lots of different types of sexual health assessments. I don't know if you've come across a lot, Paige, but there's lots of different ways. And it is hard to do a big comprehensive one in a busy outpatient clinic, but they do have some shorter ones on there and they give you some good tips. And then the last bit is looking at the evidence-based approaches and helping you to learn how to counsel and how to treat effectively. And this is a really good thing about the module. If you get a bit sick of reading one bit, they've got videos, they've got little activities that you can do. It's really quite interactive. So, and you can go on and do some short answer questions, and they've got multiple choice. The search function, you can just go through and look up whatever area that you want to. So that's a handy part of the tool. When they did the pilot testing, many health professionals expressed the need for a resource to guide and improve their ability to deal with these areas, and that's why they set this up. And the health professionals within the workshop reported that they felt a lot more confident in addressing those areas, because a lot of us in just our nursing training, I can say personally, we didn't have that much training in these areas. The range of issues addressed in the modules, coupled with case studies and learning activities, provided an interactive environment which really helped with learning. So implementation was done there, and it just shows you here where to go on to www.cancer learning, and that's on this sheet as well. And just like to acknowledge the team that helped us to put all of that together. And I did have a nice little video here for you, but I don't think it's working, is that? I'll just quickly say that the takeaway points with this then is that this resource can be helpful for everyone, clinicians and consumers. It can help people in all areas, not just oncology. It's a life tool as well, so it can help personally. You learn from it. And you can undertake it in your own time and in your own home. You can get continuing education points. And always be aware of the area affected. I think that's one of the key things, and Linda touched on that. Always be aware of the area that you're treating, if chemotherapy or radiotherapy, and how that can impact on the person. And not just the person, quite often in the clinics you find it's the carer that's affected as well, and how they always need to be included in the treatment. We'll just see if you think it will work. It has lots of little things like this where it can show you how you can address with patients. Oh, sorry.
said I'd get some after treatment, but she didn't go into much detail.
Radiotherapy can have a variety of effects on the vagina, and one of the most significant is something we call stenosis, where as a result of scar tissue, the vagina can become quite narrow and lose its elasticity. This creates a couple of problems. Firstly, coming back despite physical examination. And if the vagina is too narrow, it's very hard for them to see any changes at all. Plus, it may be very sore and painful for you. Equally, these changes may have an intercourse painful and difficult for you. Using the dilators, as the registrar mentioned, can prevent stenosis from happening.
Well, obviously it's important to me that the doctors can examine me easily, and Dave and I have only been married 6 years, and making love is a significant part of our relationship. I'd hate to lose that. We worked this through together because when we first met, I was pretty low after a really difficult divorce from my ex-husband. And just after that, I started to go through the menopause. I put on quite a lot of weight, and I really didn't know how he could still find me attractive, but he makes me feel like the most beautiful woman in the world. So, what do I have to do with these dilators?
Okay, I'll show you. They come in 3 sizes with a handle, okay? We suggest that you use the smallest size first, like this. It's recommended that you use the dilators 3 times a week, about 4 weeks after you finish radiotherapy. Okay? Many women find it easier to incorporate it into a routine, like washing your hair, shaving your legs, brushing your teeth, etc. It's much easier to insert them if you're feeling relaxed, so perhaps having a bath or a shower, and then finding a nice, comfortable place where you'll be undisturbed. Many women find it comfortable to lie on their backs with their knees apart, slightly bent. Other women find it useful to stand with one foot on the edge of the bed or the bath. Use a movement on the end of the dilators and also just inside the vagina.
It looks a bit stunned.
Once inside the vagina, it should be used in a forward and backward motion, and then a left to right motion. The dilator should be removed slowly, rotating it in a clockwise and anti-clockwise motion